Well, hello, everybody. Today we're sitting here on August the 25th of 2021, and we've been speaking about a lot of topics dealing with the pandemic over the past year or so. And one individual, Dr. Chai, who has graciously offered to come back and chat with us about where we are today with this pandemic, the virus, and his patients and what he's seeing on a daily basis. So thank you, Dr. Chai.
Absolutely, my pleasure.
So you're, as an MD, you're a pulmonologist. Can you also just tell us what areas of expertise do you are you in, and what is your specialty?
So I'm a pulmonologist. I'm an intensivist. That is, I'm a physician in the intensive care unit. I'm the medical director for chronic lung diseases. I'm a researcher. I have done research on multiple medications that are being used in COVID-19. And I also take care of patients who have post-COVID long haulers. I see a lot of them in my clinic, and we have some protocols built for those patients. So I'm involved with COVID-19 since it started, the acute patients, the patients in the hospital, as well as the long-term implications of them in some of these patients who suffer. So.
And one of the things, and you're really in the thick of this on a daily basis, and we've known some of your patients who've told us how wonderful you were, and so we thought, well, you're the expert here in Northern Kentucky. You're one of the experts who we need to speak to again. So as we sit here today, Doctor, there's so many questions, and you're exhausted by this. I'm sure your team is exhausted. You want everybody to be completely healthy. And we're here today to talk about things that are not political. We're not talking about policies, but we want to talk about medical treatment capabilities and what we have available and what you're seeing. So with that, let's just talk about right now what you're seeing in terms of the number of ICU beds that are being occupied by patients, and kind of how that's been on a trajectory.
So unfortunately, we have a new wave of COVID cases. The cases are going up very acutely. Like the trajectory is going up very fast. The curve is very steep with the Delta cases. This is what is expected from what we have seen in other countries as well. The ICU is getting full, mostly with patients who are not vaccinated. Unfortunately, we are seeing a lot of patients even in their 30s and 40s, which was not as common in the previous waves. We are seeing a lot of patients who are obese or who have other comorbid conditions like diabetes and stuff like that, who are not vaccinated, get very, very sick. There are a few vaccinated patients, very few of them, who get sick, but those are the kind of patients who are immunocompromised. Like, for example, they have been on steroids for multiple years, or they have an organ transplant or something like that. And now studies have proven that 2 doses of vaccine are not enough for such patients, which is why CDC has approved a 3rd booster dose for those kinds of patients. And I'm hoping that that will decrease those kinds of cases.
So those who have been vaccinated, that you're seeing that if they do end up admitted because of their serious health issue, it's because normally, or can you say all of them in Northern Kentucky that you've seen have all had some kind of comorbidity issue of some sort? Or
not necessarily at all. In fact, COVID is a kind of a disease where it is very unpredictable.
Gotcha.
To tell who gets sick and who does not. We have seen many examples where the wife and husband, both similar age, similar comorbidities, both have high blood pressure, diabetes. The husband is not that sick, but the wife is in the ICU on a ventilator, and the husband comes in and is like, why is she sick and why am I not sick? There is also survivor guilt many times, and that is very sad to see.
Sure.
There are many theories on why one person gets sick and other does not. It's easy to point fingers on comorbidities like obesity and diabetes and other kind of stuff, but there is still a lot that we do not know. So sometimes we do see patients who are healthy otherwise, and they come in, they're not vaccinated because they never thought they would get the disease in the first place. And they did not take necessary precautions to protect themselves. And because the waves had gone down and people felt the disease was behind us to some extent, and now we are seeing a lot of them being very, very sick. So it's an unpredictable disease in that way, because of which many times we healthcare professionals recommend everyone to be careful because it's very difficult to pinpoint who will get sick and who does not.
Great point. So obviously you're encouraging patients and all of us to be vaccinated. Are there cases where right now you see those who have already been already had COVID, and the person asks you, or if I were to ask you that, I've had COVID in the previous, not the Delta variant, and I really don't think I need to be vaccinated now. What would you tell me?
So there are different kinds of studies that we have seen. In Kentucky itself, there was a study done about on 600 patients, which CDC quotes all the time. In that study, what they saw was if you had COVID but did not get the vaccine, and if you compare that to people who had COVID but got the vaccine, the category in which you did not get the vaccine, the chances of getting COVID again was 2.5 times higher than the category where you got the vaccine. So getting the vaccine protected you 2.5 times more than not getting the vaccine, even if you had COVID before.
Gotcha.
Now, I will say that there are multiple studies floating around, right? Everyone is doing studies and research on this. So there are some studies which probably have shown that whether you get vaccine or not, if you had COVID before, the natural immunity does protect you to a decent amount. So there are some studies which say this, there are some studies which say vaccination helps you a lot more even if you got COVID before. So when you get multiple studies like this, every study you have to see what is important. And then you have to see, do you err on the side of being more careful or not? And a lot of my patients, being a lung doctor, have lung diseases and stuff like that. They cannot afford to get COVID again. So even though they got COVID before and they barely made it through, I would recommend the vaccine so that they decrease the chances even more of getting COVID again.
Somebody told me recently also between this question of vaccinated or unvaccinated, individual who I trust said, here's the case. It's not a question of if with someone who's not vaccinated ever gets COVID, but it's a matter of when. And so because would you agree with that statement that if I decided not to be vaccinated and I've never had COVID before, that I'm going to get it eventually if I stay unvaccinated?
Unfortunately, that's how it appears to be, because with Delta variant, the transmission rate is super high. The amount of virus that you find in the nose of someone who gets the Delta virus is much, much, much higher than the previous variants. So it transmits very fast, and we have seen that in other countries, and now that we are seeing that in the United States of America as well. So it almost feels like, since there is no age that is truly protected from COVID, since there is no true comorbidity that is protecting you from COVID, like you really cannot say, this person for sure will not get COVID. There is nothing like that. So everyone is at risk for getting COVID at one point or the other. You fly in a plane, you're in a closed compartment with poor ventilation, and if one of those people has COVID and he's coughing, everyone is at risk of getting COVID. So when there is so much risk around and we cannot afford closing down, it does so much bad things to economy and to people's lives, it almost feels like the risk of COVID is always there.
Yeah.
And it's better to get COVID after you get vaccinated, where you might get a much milder disease or no disease at all, or it might protect you from COVID completely. That is way better than not getting vaccinated and taking a chance of getting COVID.
Great question, or great point. So let's talk about the variants in a moment. So the Delta variants come out. Let's just say in the next month or so, there's a big drop of the ICU patients, and we maybe get back even to another second round of feeling more normal and not quite so worried about people getting sick. Will there be another variant, and would it be less or more strong than the Delta variant?
Unfortunately, we already have reports of other variants coming out. We already have reports of what is called as a Delta Plus. California had a few cases, and unfortunately, the vaccine is shown to be protective against that as well. And then in other countries, there is another variant called as Lambda, which is expected to spread. Once again, the vaccine has been shown to be reasonably protective against the Lambda variant as well. So in one way, taking the vaccine right now not only protects you from Delta, but the next couple variants that are expected to come. So it's not just about trying to push through this wave right now. It's about how are we going to push through the coming winter and the months after that, when there are other viruses which are going to be a problem as well.
Great question. Great point. So let's talk about the actual vaccine itself. And we've all heard this many times saying, doctor, you want me to put this vaccine in my body? We had the emergency approval. Now we've had one company's product has been approved now is without the emergency approval. But these vaccines should be taking years and years, if not decades. Why would I want to trust it?
So the interesting point is there's not just misinformation, there is less information that I think people should have. People should have more information to learn more about this. Number one, COVID-19 is not the first dangerous coronavirus that has come about. It's actually almost the seventh version of coronavirus that has created havoc. Before this, there was something called as MERS, Middle Eastern Respiratory Syncytial Virus. Before that, there was a SARS-CoV-1. And before that, there were other coronaviruses. There have been research papers from 10 years back saying something like this could happen because coronaviruses are notorious to have mutations in nature. Coronaviruses have been trying their best to spread in the world, to infect human beings and make it worse. And every version of coronavirus has been worse than the previous version. So scientists have been studying coronaviruses, the potential treatments, and the potential vaccination routes for many, many years now. So it's not like COVID-19 showed up last year or the end of 2019, and people said, okay, let's sit down and see how we can make a vaccine. They have been working on it for many years, even before that. But what happened with COVID-19 is once COVID-19 came, they identified that, yes, this is a new virus that does spread among human beings in a very bad way. They had to figure out what the genetic code of the virus would look like. Once they got the genetic code, they already had all the machinery in place in how to convert that genetic code or the information that the genetic code gives into things that can make into a vaccine. So that's why they were able to make a vaccine much more quickly than before. And when COVID-19 first came, everyone was like, I wish there was a vaccine coming quickly. And when the vaccine came, there were many people who were like, I think it came too quickly. In all of this sense, it is important to see what the major scientists and the big research bodies and organizations, what they're thinking, because everyone looks into the studies, they look into the papers. For example, when the vaccine first came out in December of last year, I got the vaccine as a healthcare worker, not only as someone who works in the ICU with these patients, but also as someone who has to set an example. It's not about my rights, it's about my obligation towards my patients.
Sure.
But the vaccine was not available to my wife at that time. She's not a healthcare worker. But my wife was like, I want to get the vaccine right away. I said, you know what, wait. The data will slowly come out. Let's see how good the vaccine is. Couple months went by, more and more data came out. Even for my own wife's safety, I went through the data in a lot of detail. And when I was confident that the data was good, I said, yes, it's time for you to get the vaccine. I give the same recommendation to my patients as I would give to my family member. My mother, she got the Pfizer vaccine based on my recommendation after I looked at all the data. So all of these things, it's not like we just started working on them last year. The misconception is, how can you make such a good vaccine in such a short time? So we are missing something. We have been studying coronaviruses and vaccines for more than a decade. So that's why it has been possible to make this vaccine this quickly around this time.
Great. Thank you for that real great clarification. To that point, I've also heard people say before that, there have been previous vaccinations, even, and I'm not going to say it specifically polio, for example, but key vaccinations that were first tried, and they actually had really negative ramifications. And then it only was found many, many years later, not just
Mhm.
2 or 3. Can you give a sense of confidence that we should have in this set of type of vaccinations compared to what might have been done 30 or 40 years ago?
So the one thing about this disease and this vaccine is the disease spread not just in one country or slowly, it spread throughout the world very rapidly. So the number of people who get the disease is a huge number. It allows anybody who is testing things like vaccine and stuff like that to quickly ramp up on getting subjects into the study than any time before. In the olden days, when we had polio and these kinds of diseases, they did not spread like this disease did, because this disease is perfect for spread in today's world. It's a respiratory infection. It can spread by touch as well. And we fly everywhere. The whole world is connected in one global community. So the disease spread like really fast. So with this many cases, they were able to recruit a lot of people who were willing to try this vaccine, because of which they got the data in much faster as well. In fact, all the medications that were tested for COVID-2, we were able to recruit patients very, very quickly, because not only we had this many patients, the patients were desperate to find some kind of a solution. The doctors are desperate to find some kind of a solution. So the research has been accelerated much more than in olden days or many, many days before.
Yeah.
Now, when you come to this vaccine itself, the side effects and stuff like that, anytime you think about a side effect of a vaccine, you have to think about the rate at which it happens, like in how many patients you gave the vaccine, in how many people, in those people, how many are potential to get a side effect. Then you have to see if the side effect is a dangerous one, or is it a reversible one. If it is just a rash that goes away, then it's really not a big deal. Yes, I would not want to get any rash even for one day,
Sure.
but in the big scheme of things, if it is something that comes and goes away, then it's not a big deal. If it's a blood clot, then it means something. Then, but what do you do for the blood clot? Is it treatable? Is it dangerous? So when they looked at all of those kinds of things, the vaccine still wins, because COVID is such a dangerous disease. It affects every organ in the body. It causes problems in the brain, the lungs, the heart, the blood vessels, the skin, the endocrine system, the kidneys. It causes so many problems. The very rare side effects in the vaccine do not feel like a major obstacle when you are trying to protect yourself from the disease itself. In the olden days, when people talked about vaccines and stuff, they had the luxury to sit back and say, you know what, I will not get the vaccine now. Let me wait for a year or 2 years. Because the diseases we are talking about in the olden days, some of those diseases were not that dangerous. But other diseases like diphtheria or some other diseases that affected kids, which were rapidly spreading, vaccines were very, very useful. Vaccines have saved us against measles, diphtheria, a lot of diseases without which we would be struggling right now. So vaccines are really helpful. I would not blindly accept them, but what I would say is the data is very much supportive that vaccines are going to be very useful at this day and age for this disease.
Well, I want to talk about the third shot or a booster shot, because for a moment, but before we get to that question, it ties into this first, if I could ask you this question. When it really comes down to it today, there's this worry that says, why should I trust the government? Okay, we have all liked to pick on the government forever. The CDC right now, we hear information one day, it might change a week later, it might change a month later. And even especially now turning into this, well, now we are likely to need to get this third shot or booster shot. And therefore, I don't want to trust anybody. I just think that it's crazy. No one knows what they're doing. Why would I want to trust an organization like that, CDC, out of the government, because they're changing their story all the time? Can you speak to that a bit? And why would I want to trust what I'm hearing?
It's a very sad situation, and trust is extremely important. What I would say though is you need to know what kind of expertise you're getting from which source. If you ask me a question about any of your family members who have a heart disease and say, Dr. Chai, what do you think I should do for him? I would say I'm a pulmonologist. my expertise in pulmonology. Yes, I have studied the heart in medical school. I see a lot of patients who have heart problems. But what I think about the heart disease is my opinion. It is not my expertise. My expertise is in pulmonology. I've done a lot of research in COVID myself, and I am very much into treating these COVID patients in the ICU and in the clinic. I'm a pulmonologist and I'm an ICU doctor. So I have expertise in COVID. So when I talk about COVID, it is nothing political. It is not even policy. It is purely medical and research oriented from that. So it is important to trust expertise sources who have true expertise in that field.
Mm-hmm.
Unfortunately, either in the media, in the news, anybody who has a mic becomes an expert and they speak things, and then you see some policies which remove trust, where people are not able to trust. I don't trust many things that come on TV, I guess, and some things that the government says, I might not trust it. Something that comes on Wall Street, I might not trust it. But this is a true medical crisis right now. And we have gotten ourselves into a situation where when I tell someone, yes, the ICU is very, very busy with COVID patients, and there are some medications we are running out of. So there's a medication, for example, called tocilizumab. Next month, if a COVID patient shows up in the ICU, we might not even have access to it because we are running out of the medication nationally. When I say that to people and they say, is this really true? That really breaks my heart because there is no reason for me to make that up.
Mm-hmm.
And when somebody asks me a question, are you recommending the vaccine because you get a commission either from the government or from the vaccine company? That breaks my heart because I don't. We don't actually make any money from that. In some ways, the hospital actually loses money on those kinds of endeavors. So it is important to have trust in those who are not only involved in the care of those patients, and they're involved in that care not for the money of it, but because that's what their oath is. It's also important to trust those people who actually have true expertise in that field. Not someone who said, I read this article somewhere, so this is what I think about it. I mean, that becomes an opinion. You really need to trust expertise. So when CDC says certain things, like today wear a mask, tomorrow don't wear a mask, that really hurts. Because one day when they said N95s, you should all wear N95s. The next day they said, well, regular mask is good enough. And the other day they say, you should double mask. Those kinds of things don't filter well to the common man.
Right.
To the common man, it almost sounds like you're flip-flopping. You don't know what you're trying to say.
Sure.
The CDC, what it does is based on the data it gets and based on the resources it has, it gives the best recommendation. But the way it filters down to the common man is different. So irrespective of all of that miscommunication, I would plead to the common man that masking is important. It is not the all-in-all solution. Masking will not protect you 100%, but it will do its part. N95 mask is better than a regular surgical mask, but you don't need to wear an N95 mask all the time. Only when you know someone truly has COVID and you need to be in close contact with them like a family member, then an N95 mask is better than a regular mask. Other than that, a regular mask is good enough. And vaccination really helps in decreasing the chances of getting the disease. You can still get the disease, but you'll hopefully get a minor, mild disease if you get vaccination. And that is what the data is saying. So I'm not going to sugarcoat it and say vaccination protects everybody, masking protects everybody, because that's where people look at it and say, that doesn't sound true. Why are you lying to me? So it's important to tell them exactly what is what. And I hope everyone realizes that I am saying this and many others are saying this because we are really tired of seeing people dying in the hospital. So we really want people to be safe and healthy.
Thank you. Well, can we, and I could probably talk about this with you for hours, but I want to be respectful of your time. The issue of the booster, the third shot. If I'm not immunocompromised, or if I don't have any other issue health-wise, and I've heard the 8-month from your last shot time frame. At this point, it sounds like that's something that we will all have as an option, and you would suggest or tell us what your thoughts are on that. And then again, why should I, and maybe it goes back to your previous comments about the trusting factor of, hey, now I'm being told that I'm going to need this extra one where we were told before we probably wouldn't need it. And maybe the opportune point there is it was likely not to need it, but speak to that a bit and what's your feeling on this third shot?
So I think this decision mainly came out based on the experience in Israel. Israel has been a huge talking point, even for people who are pro-vaccine and even for people who have their doubts about vaccine. Why? Because Israel got the Delta wave earlier than we did, a few months earlier. And Israel is one of those countries which is well known for vaccinating a huge portion of their population. So it stands as an example as a pro-vaccination country who got the Delta wave, and what did that do to their cases? So everyone is looking at places like Israel to get some information on what to do.
Okay.
So what happened in Israel is the Delta wave came, and many who got vaccinated also got COVID. Obviously, the ones who did not get vaccinated got a higher percentage of cases. But in a country where most people got vaccinated anyways, when you look at those numbers, there were many people who were vaccinated who got COVID as well.
Mm-hmm.
Now, if you drill down into the data, what you realize is people who were in the older age group were the ones where vaccinated people got more COVID. Like, not more COVID than unvaccinated people, but compared to the lower age groups, the younger age groups, people who are older than 60, 70, 80 had more cases, even though they were vaccinated, compared to people who were younger than 60 years of age. When they looked into the data further, saying, why did these age groups get COVID compared to their younger age groups when both of them were vaccinated, they realized that their vaccine rollout program was first to the older age groups. Then they rolled out their vaccine program to the younger age groups after. Then they did a study in terms of how the antibodies stay in the body and how they tend to come down. And they realized that it takes about 8 months for your protective antibodies in your body to slowly come down. Now, based on the data, Israel has started vaccinating the people who got vaccinated early on in their vaccination program, which was 8 months back. They started revaccinating them, that is the third booster dose. And immediately they saw a big drop in cases in that age group as well.
Gotcha.
So for many other countries, it felt like, oh, so they did see a problem. They drilled down to the root cause, and giving a third dose fixed their issue. Like the curves, the unvaccinated curve keeps going up, but the third vaccine booster dose curve starts coming down. So when many countries saw that, the third booster dose sounded very reasonable thing to do. You will hear some other countries say, please don't do the third booster because there's not enough vaccine for all countries. So when some other countries say that, the people who are vaccine hesitant take that message and say, see, this other country is recommending not to get the third booster dose. But that's a different kind of conversation. They're saying it only because they're concerned there is not enough vaccine to go to the whole world. And that's a different topic, and that's a different argument.
Right.
But if you purely look at the data that CDC is looking at, to decrease the number of cases that are in this country and to prevent a spike of cases in the older population who already got vaccinated, they're recommending to get the third booster dose so that we are all protected in case our antibodies start coming down, if that makes sense.
It does. And in fact, I guess the other part of that, and you broached right into it, was, and we can wrap up here in a moment with you, is that there have been parts of the US as well, little cities, some communities who've had a fairly high percentage of those who were vaccinated get the new Delta variant. And again, should that give me pause to even think, why would I worry about getting vaccinated at all? If I'm going to have it and it comes back around and some of those people have been pretty sick, maybe speak to that a bit.
So a lot of data that we have seen, even in states where some of these vaccinated patients got the Delta virus, it was mostly mild to moderate disease and not severe and critical disease. A lot of those people were not on the ventilator or things like that. I will say that we have actually diagnosed some diseases that were unknown to the patient based on how they reacted to this whole pandemic. Like, for example, I have had a few patients where they got the vaccine, still got really bad COVID. And then when we looked into it, that patient had severe immune deficiency that they were not aware of. We had a patient, a young patient in 20s, who got the vaccine, got COVID. The fever from COVID did not go away for 4 months. That's when that person came to us. And when we checked the immune levels, all the immunity numbers that you check, the IgG, IgM, Ig, they were practically zero. We had to bring in an immunologist, a hematologist to start that patient on different kinds of treatments. And it's not a surprise why that person got COVID after the vaccine. In fact, not only COVID vaccine, any other vaccine she might have taken in her life were not working for her. So there are multiple examples like that, which shows that when you see someone get the vaccine and then get COVID, you don't know the full picture of what happened. So you need to drill down in the data to get more sense. What I can tell people from what I've seen in our own organization is you walk through the ICU and you practically see all the sick ones being unvaccinated, and you see people who have very poor immunity, where it's not a surprise that the vaccine didn't hold well. So in those people, the booster probably will help more. And when we see that as a common standard thing, it's very difficult for me not to recommend a vaccine. Because I'm really hopeful that something can be done to prevent them from coming into the hospital. Because the other important thing is, when your hospital is full with all these patients and everyone gets sick, next thing you know, as we saw in places like New York, doctors start getting sick, nurses start getting sick, the whole community gets sick. Even the people who are not COVID, cancer patients, heart patients, lung patients, the hospital is not available to care for them. The beds are not there to care for them. The resources are not there to care for them. They're not enough ventilators. This is going to affect everybody, COVID and non-COVID. So we are trying our best to wrap our head around it to see how we can slow the disease down as much as possible.
So, doctor, if I happen to be pretty fearless and I'm not worried about being vaccinated, or I'm not worried about actually getting the COVID, because I know that you've got great medicines available, great treatments available to probably keep me healthy, what do you say to that?
The problem with COVID-19 is, first of all, it's unpredictable who gets sick how much. So let me give you some examples. You could have a mild disease of COVID and really no need for any treatment or any of that sort. But many times, especially if you're not vaccinated and your body does not know how to fight the virus, since it has not experienced the virus before, there is a chance of still having long haulers disease, which is pretty bad. And there are a lot of symptoms from long haulers which do not have good treatment options. You could have a severe disease from COVID. You go to the hospital, we give steroids and some other treatments. The response from those treatments is not highly predictable, in the sense that not everybody gets better with these treatment options. So we do not have an inexpensive, reliable treatment option against COVID-19 once you get admitted to the hospital, once you get a severe disease. We have the best we do, and most people actually make it, but you don't want to be one of those people who does not make it. There's actually a statistic which I saw a few months back, which really made me very sad. They were plotting the number of kids who have been orphaned since the start of the pandemic. And that makes me really sad, because if there is anything we can do to prevent from something like that happening, I would definitely do that. And taking a chance and saying, well, I will take the medications that the hospital will give me, you are really taking a chance at that time. It's a 50-50 chance if those medications will work or not. And many people who actually survive COVID, once they get on a ventilator and things like that, being in the bed for days on ventilator, you don't just get up and walk and get back to your life before. So many of those people end up in rehabilitation centers, in nursing homes, or they have so much muscle weakness that they can't go back to the work that they used to before. So even those, like, death from COVID is not the only metric that people should be looking at. A lot of people who survived COVID have not really gone back to their usual life. So that's why I really think people should do whatever they can to prevent getting COVID.
Well, Doctor, you're again, I want to say thank you for all the things you've been doing over the past couple of years. And I know you've been saving lives, even though people have unfortunately lost their lives. But if there was one message you could send to, you've only got a certain number of patients, the whole Northern Kentucky community or in Kenton County, what would it be? What would the message be today?
I would say that those who have gotten the vaccine or those who have not gotten the vaccine, please don't get into any kind of an argument. I don't, the lack of trust between people, the lack of respect between people, that is counterproductive. We all need to be united. We all need to make sure and realize that we all want everyone to be safe and healthy. Please trust your healthcare community. Please trust the doctors or anybody else who you would trust for other reasons. Like if you had cancer, you would go to see your doctor and you would trust what the doctor would say. If you have a concern, get a second opinion from another doctor. So have trust in experts and be patient, and let's do our best to protect our community and get through all this stuff.
Well said, Doctor. Thank you so much for the time. I really appreciate it.
Thank you.